What if I told you that 3 vitamins sitting in your medicine cabinet right now could be silently increasing your stroke risk by up to 40%? If you're over 60 and taking daily vitamins, this could be the most important video you watch this year. I'm about to reveal 3 actual vitamins that millions of seniors take believing they're protecting their health, when they might actually be putting themselves in danger. Don't click away. Your life could literally depend on what you learn in the next 16 minutes. Welcome to the channel where we cut through health myths and give you evidence-based information that could save your life. I'm here today because stroke is now the 5th leading cause of death in America, and what's truly shocking is that many cases in seniors over 60 could be prevented if people knew what I'm about to share with you. Here's what most people don't realize. Every 40 seconds, someone in the United States has a stroke. For those over 60, the risk doubles every decade. But here's the kicker. Some of the vitamins you're taking to stay healthy might actually be working against you. If content like this helps you make better health decisions, smash that subscribe button and ring the notification bell. Trust me, you'll want to catch every video in this series. Before we dive into the specific vitamins, let me paint you a picture of why this matters so much. The global vitamin and supplement industry is worth over $150 billion, and seniors are the largest consumers. Walk into any pharmacy, and you'll see entire aisles dedicated to vitamins marketed specifically to older adults. The problem? Most people, including many healthcare providers, operate under the assumption that vitamins are always safe because they're natural. This couldn't be further from the truth, especially for seniors whose bodies process nutrients differently than younger adults. As we age, several critical changes occur. Our kidneys become less efficient at filtering excess nutrients. Our liver's ability to metabolize compounds decreases. We're more likely to be on multiple medications that can interact with vitamins. Our blood vessels become more fragile and susceptible to damage. These changes mean that vitamin doses considered safe for younger adults can become dangerous for seniors. What's particularly insidious is that vitamin-related stroke risk often develops silently over months or years, with no obvious warning signs until it's too late. Today, I'm focusing on the 3 vitamins with the strongest scientific evidence linking them to increased stroke risk in seniors. These aren't fringe supplements. These are vitamins that millions of people over 60 take daily, often on the advice of well-meaning friends, family, or even healthcare providers who may not be aware of the latest research. Our first vitamin is one that's been marketed as a miracle antioxidant for decades: vitamin E. If you're taking vitamin E supplements, especially in high doses, you need to pay very close attention to what I'm about to tell you. The shocking research. The Heart Outcomes Prevention Evaluation Study, one of the largest vitamin studies ever conducted, followed over 9,000 people for nearly 7 years. What they found was alarming. Participants taking 400 IU of vitamin E daily had a 22% increased risk of hemorrhagic stroke compared to those taking a placebo. But here's where it gets even more concerning. A comprehensive analysis published in the Journal of the American Medical Association looked at 19 different vitamin E studies involving over 135,000 participants. The conclusion: high-dose vitamin E supplementation was associated with increased mortality and stroke risk, particularly in seniors. Why does this happen? Vitamin E acts as a powerful anticoagulant, essentially a blood thinner. While this might sound beneficial for preventing clots, it becomes dangerous when you consider that seniors are already at higher risk for bleeding. As we age, our blood vessels become more fragile, and our clotting mechanisms become less efficient. 2 medication interactions are common. If you're taking aspirin, warfarin, clopidogrel, or any other blood-thinning medication, which many seniors are, adding high-dose vitamin E creates a compounding effect that can be deadly. 3. The synthetic form is particularly problematic. Most vitamin E supplements contain synthetic alpha-tocopherol, DL-alpha-tocopherol, which has been shown to be more harmful than natural forms. Real-world case study. Let me share a case that illustrates this danger. A 67-year-old woman came to the emergency room with a massive brain hemorrhage. She had no history of high blood pressure, no head trauma, and no obvious risk factors. The only unusual finding? She had been taking 800 IU of vitamin E daily for 3 years, believing it would prevent heart disease. Her vitamin E blood levels were nearly 5 times the normal range. The dangerous dose threshold. Research consistently shows that problems begin at doses above 400 IU per day. To put this in perspective, the recommended daily allowance is only 15 milligrams, about 22 IU. Many vitamin E supplements contain 400 to 1000 IU per capsule. Some people take multiple supplements containing vitamin E, unknowingly exceeding safe levels. Hidden sources you might not know about. Multivitamins often contain 30 to 400 IU of vitamin E. Fish oil supplements frequently include vitamin E as a preservative. Some prescription medications contain vitamin E. Fortified foods can add to your total intake. Warning signs of vitamin E toxicity. Easy bruising or bleeding. Prolonged bleeding from cuts. Blood in urine or stool. Excessive fatigue. Blurred vision. Nausea. What you need to do right now. 1. Check every supplement you take for vitamin E content. 2. Add up your total daily intake from all sources. 3. If you're exceeding 400 IU daily, consult your healthcare provider immediately. For if you're on any blood-thinning medications, vitamin E supplementation should be avoided entirely. 5. Consider getting a vitamin E blood test to check your current levels. Our second vitamin is vitamin A, specifically the retinol form found in most supplements. What makes vitamin A particularly dangerous for seniors is that toxicity can develop slowly and silently over months or years, and one of its most serious complications is increased stroke risk through elevated intracranial pressure. The accumulation problem. Unlike water-soluble vitamins that your body can easily eliminate, vitamin A is fat-soluble, meaning it gets stored in your liver and fat tissues. As we age, our liver's ability to process and eliminate excess vitamin A decreases significantly, leading to dangerous accumulation. The stroke connection. High levels of vitamin A can cause a condition called pseudotumor cerebri or idiopathic intracranial hypertension. This condition increases pressure inside the skull, which can lead to stroke in several ways. 1. Direct pressure on blood vessels. Increased intracranial pressure can compress blood vessels in the brain, reducing blood flow and increasing stroke risk. 2. Blood vessel integrity. Excess vitamin A can weaken blood vessel walls, making them more prone to rupturing or forming clots. 3. Blood pressure elevation. Chronic vitamin A toxicity often leads to systemic high blood pressure, a major stroke risk factor. The research is concerning. A large-scale study published in the New England Journal of Medicine followed over 72,000 women for 18 years. Women with the highest vitamin A intake, above 3,000 micrograms daily, had a 48% increased risk of hip fractures, but more concerning was the cardiovascular data showing increased stroke incidence. The Nurses' Health study found that women consuming more than 1.5 milligrams, 5,000 IU, of retinol daily had significantly higher rates of cardiovascular events, including stroke, compared to those consuming normal amounts. Why seniors are at particular risk. 1. Decreased liver function. The liver's ability to store and metabolize vitamin A declines with age, making toxicity more likely. 2. Medication interactions. Many seniors take medications that can affect vitamin A metabolism, including cholesterol-lowering drugs and certain antibiotics. 3. Multiple sources. Seniors often unknowingly consume vitamin A from multiple sources: multivitamins, individual supplements, fortified foods, and prescription medications. The dosing danger. The recommended daily allowance for vitamin A is 900 micrograms, 3,000 IU, for men and 700 micrograms, 2,300 IU, for women. However, many supplements contain 5,000 to 25,000 IU per dose, up to 8 times the safe amount. Real case example. A 72-year-old man came to his doctor complaining of severe headaches, nausea, and blurred vision. His symptoms had developed gradually over 6 months. Blood work revealed vitamin A levels that were 4 times the normal range. He had been taking a high-potency multivitamin containing 25,000 IU of vitamin A, plus an additional vitamin A supplement containing 10,000 IU daily. An MRI showed signs of increased intracranial pressure. 2 weeks later, despite beginning treatment to reduce his vitamin A levels, he suffered a stroke. The excess vitamin A had been slowly building pressure in his brain and weakening his blood vessels. Warning signs of vitamin A toxicity: persistent headaches, especially upon waking, nausea and vomiting, blurred or double vision, dizziness and balance problems, bone and joint pain, skin changes, dryness, peeling, hair loss, fatigue and irritability. Hidden sources of vitamin A. Multivitamins often contain 2,500 to 5,000 IU. Fish liver oil supplements, liver and organ meats, fortified dairy products, some prescription acne medications, certain eye health supplements. Critical tests you need. 1. Serum retinol levels. This measures vitamin A in your blood. 2. Retinol ester levels. This shows vitamin A storage status. 3. Liver function tests, to check for vitamin A-related liver damage. What you must do immediately. 1. Calculate your total daily vitamin A intake from all sources. 2. If you're exceeding 3,000 IU daily, reduce your intake gradually. 3. Get vitamin A blood levels tested if you've been taking high doses. 4. Check with your doctor before stopping, as sudden withdrawal can sometimes cause problems. 5. Focus on getting vitamin A from food sources like carrots, sweet potatoes, and leafy greens. The safer approach: instead of preformed vitamin A, retinol, consider beta-carotene, which your body converts to vitamin A only as needed. Beta-carotene doesn't accumulate to toxic levels the way retinol does. Our third vitamin is perhaps the most controversial because vitamin D has been promoted so heavily for bone health that many people are taking megadoses without realizing the cardiovascular risks. I'm talking about vitamin D toxicity, a condition that's becoming increasingly common as supplement doses have skyrocketed. The calcium connection crisis. Here's what happens when you take too much vitamin D. Your body starts absorbing massive amounts of calcium from your intestines. This leads to hypercalcemia, too much calcium in your blood. That excess calcium has to go somewhere, and unfortunately, it often ends up in your arteries, making them stiff, narrow, and prone to forming clots. The research is eye-opening. The Women's Health Initiative, which followed over 36,000 women for 7 years, found something shocking. Participants taking high-dose vitamin D plus calcium had a 17% increased risk of stroke compared to those taking a placebo. Even more concerning, a Danish study published in the American Journal of Cardiology found that people with vitamin D blood levels above 100 nanograms per milliliter had a 40% increased risk of atrial fibrillation, a major stroke risk factor. A comprehensive meta-analysis published in the British Medical Journal analyzed data from over 40,000 participants across multiple studies. The conclusion was clear. Vitamin D supplementation above 800 IU daily was associated with increased cardiovascular events, including stroke, particularly in people over 65. Why vitamin D toxicity is particularly dangerous for seniors. 1. Kidney function decline. As we age, our kidneys become less efficient at regulating calcium and vitamin D metabolism. This means toxicity can develop more quickly and be harder to reverse. 2. Medication interactions. Many seniors take thiazide diuretics for blood pressure, which reduce calcium excretion. When combined with high-dose vitamin D, this creates a perfect storm for hypercalcemia. 3. Existing cardiovascular disease. Seniors are more likely to already have some degree of arterial disease. Adding calcium deposits accelerates the problem dramatically. 4. Magnesium deficiency. Most seniors are deficient in magnesium, which is essential for proper vitamin D metabolism. Without adequate magnesium, vitamin D supplementation becomes more likely to cause problems. The dosing disaster. Here's where things get really concerning. The recommended daily allowance for vitamin D is 600 to 800 IU for seniors. But I regularly see patients taking 5,000 to 10,000 IU daily, sometimes on the advice of healthcare providers who mean well but aren't monitoring appropriately. Case study that illustrates the danger. A 69-year-old woman came to the emergency room with confusion, nausea, and irregular heart rhythms. Her vitamin D blood level was 140 nanograms per milliliter, nearly 3 times the upper normal limit. Her calcium was dangerously high at 12.8 milligrams per deciliter. Normal is up to 10.5. She had been taking 8,000 IU of vitamin D daily for 18 months because a doctor told her it would prevent fractures. Within 8 months of starting this regimen, she developed kidney stones. A year later, she had episodes of chest pain. The high-dose vitamin D had been slowly calcifying her arteries. She suffered a stroke 2 weeks after her emergency room visit. The symptoms of vitamin D toxicity are often missed. Excessive thirst and urination, often mistaken for diabetes. Nausea and vomiting. Weakness and profound fatigue. Confusion and memory problems. Kidney stones. Bone pain, ironically, despite taking vitamin D for bone health. Heart rhythm abnormalities. High blood pressure. The testing crisis. Many people taking high-dose vitamin D never get their blood levels checked. This is like driving blindfolded. Vitamin D metabolism is highly individual. Some people need 4,000 IU daily to maintain normal levels, while others become toxic on just 2,000 IU. What the optimal levels really are, despite what you might have heard, the optimal vitamin D blood level for most people is 30 to 50 nanograms per milliliter, 75 to 125 nanomoles per liter. Levels above 80 nanograms per milliliter start to show increased health risks, and levels above 100 are clearly associated with cardiovascular problems. Your action plan. 1. Get tested immediately. If you're taking more than 2,000 IU of vitamin D daily, get a 25-hydroxy vitamin D blood test. 2. Check your calcium levels. High calcium with high vitamin D is a red flag for toxicity. 3. Assess your magnesium status. Most seniors need magnesium supplementation, especially if taking vitamin D. Review all sources. Many foods are fortified with vitamin D, and some medications contain it. Work with a knowledgeable provider. Vitamin D dosing should be individualized based on blood levels, not arbitrary recommendations. If you've made it this far, you're probably wondering what you should do right now. Don't panic, but don't delay either. Here's your immediate action plan. Step 1. Audit your supplements today. Get every vitamin, supplement, and multivitamin you take and create a list. Add up your total daily intake of vitamin E, vitamin A, and vitamin D from all sources. Step 2. Get comprehensive blood work within the next 2 weeks. You need 25-hydroxy vitamin D levels, serum retinol, vitamin A, calcium and magnesium levels, vitamin E if you've been taking high doses, complete blood count and liver function tests. Step 3. Don't stop everything abruptly. If you've been taking high doses of these vitamins, stopping suddenly can sometimes cause problems. Taper down gradually under medical supervision. Step 4. Check for dangerous interactions. If you're on blood thinners, diabetes medications, or blood pressure drugs, these vitamins can create dangerous interactions. Step 5. Focus on food-first nutrition. The safest way to get most nutrients is through a varied, whole food diet. Supplements should supplement, not replace, good nutrition. Red flag symptoms that require immediate medical attention. Easy bruising or bleeding. Severe headaches or vision changes. Chest pain or irregular heartbeats. Severe fatigue or weakness. Confusion or memory problems. Persistent nausea or vomiting. The 3 vitamins we've discussed today, vitamin E, vitamin A, and vitamin D, are perfect examples of how more is not always better when it comes to health. The supplement industry has done an excellent job of convincing us that megadoses are safe and beneficial, but the science tells a very different story. What makes this particularly tragic is that many of the strokes and cardiovascular events caused by vitamin toxicity are completely preventable. They happen not because people are trying to harm themselves, but because they're trying to be healthy and simply don't have the right information. If you're over 60 and taking any of these vitamins, please don't ignore what you've learned today. The research is clear, the risks are real, and the consequences can be life-altering. But here's the empowering part. Now that you know, you can take action. You can get the right tests, work with knowledgeable healthcare providers, and make informed decisions about your health. Remember, aging doesn't have to mean accepting poor health, but it does mean being smarter about how we support our bodies. Sometimes, less truly is more. If this video has opened your eyes to the hidden dangers of vitamin toxicity, please give it a thumbs up and share it with anyone over 60 who might be taking these supplements. Your share could literally save someone from a preventable stroke. I want to hear from you in the comments. Are you currently taking any of these 3 vitamins? Have you ever had your vitamin levels tested? What questions do you have about supplement safety? Hit that subscribe button and ring the notification bell because next week, I'm revealing the 5 supplements that actually do have strong evidence for supporting healthy aging without increasing stroke risk. You won't want to miss it. Thanks for watching, stay informed, and remember, your health decisions today shape your tomorrow.